Welcome, everyone. Thank you for being here. We're just making sure that Zoom has enough time to admit everyone from the waiting room into our general session room here. All right. Hello, everyone. Welcome to the October 2025 PQA Quality Forum Webinar. My name is Tammy Mulm, and I am the Director of Education at PQA, and I will be your host for today's webinar. Our topic today is Driving Quality Medication Use, PQA's plan for the next 5 years. Before we get started with today's webinar, I would like to walk you through just a few housekeeping items. First, please submit your questions during the presentation using the Q&A feature located at the bottom of your screen. We will answer as many questions as we have time for during the discussion portion of our webinar. Also, the webinar recording and slide deck will be available to PQA members within the week following the presentation in the Member Resources Library section of our website. We will also post the recording on PQA's YouTube channel. Lastly, I would like to encourage all attendees to complete the quick 1-minute survey that will appear at the conclusion of the webinar. It is now my pleasure to introduce you to today's presenters. We are joined by Dr. Micah Cost, the Chief Executive Officer of the Pharmacy Quality Alliance, and Dr. Chris Kochevar, Director of Stakeholder Engagement, also at the Pharmacy Quality Alliance. Welcome, Micah and Chris, and thank you for being here. The floor is yours.
Thanks so much, Tammy, and good day to everyone tuning in with us today. So before we get to the part of the webinar here where Micah will talk about the next 5 years at PQA, we want to take a few minutes and really celebrate and reflect on what's gotten us to this moment in time. As many of you are aware, we publish each year an annual report in August, and this year's annual report summarized from the past 12 months many of the accomplishments that not only we at PQA as staff have had, but that you as our stakeholders have shared with us. And we greatly appreciate all the time, expertise, talents, and resources that you commit to PQA each year to help us continue to progress quality medication use within the U.S. healthcare system. So let's dive in. When we look at this from a top-line perspective and many of the successes that we have here at PQA, to date, at this moment in time, we have about 15 measures which are used in CMS programs. That includes programs such as Medicare, Medicaid, and the quality rating system for the ACA marketplace. Also, in the past 12 months, we've had over 200 volunteers and different work group participants with PQA. Again, your time, talents, and expertise are what makes our work at PQA possible and accelerates that work into the future. So we thank you for those contributions that you've made. Finally, your participation at our events is really what makes them the great events that they are. So at our annual meeting, we had over 360 meeting participants. At our Leadership Summit, we had over 180 Leadership Summit participants. So we thank you again for your participation there, for the education that you're able to provide, as well as the networking and connections that you make at PQA meetings. Diving in a little deeper and opening up the hood further on the work from our past 12 months, as we look at our measure development work, there's really been two key highlights that we wanted to make everyone aware of from the past 12 months. The first is our Measure Concept Advisory Group, which was run from June until September of 2025. Outputs from that group will inform future measure development at PQA, and a public comment period for prioritized concepts will be conducted before the end of 2025. So that's more to look forward to give your input and thoughts about PQA's work in the months ahead. For our COPD treatment ratio measure, it was progressed through a public comment period as well as an endorsement vote, which just concluded last week. Results of that vote will be announced soon, and the vote also included a retirement vote for 3 other PQA measures. When it comes to the umbrella that we call medication management services here at PQA, this has been a long time focus for us as an organization and for our stakeholders. In the past year, though, we've really continued to hone our focus on the quality of medication management services through initiatives such as the launch of our MTM advisory group, an educational program under development related to our medication therapy problem categories framework. So that is something that we'll look forward to launching here in the year ahead. And finally, our team has been progressing a comprehensive medication review patient experience framework, as well as a draft CMR patient-reported outcome measure. That work is ongoing, and so there will be more information on that ahead, and additional details are found in that annual report, which has been shared in the chat. When it comes to quality innovation, PQA continues to innovate in quality and identifies areas to progress towards potential future standardized measurement. To that end, PQA conducted a pharmacy measure pilot for immunization assessment and gap closure in partnership with payer and pharmacy partners. The PQA team has been hard at work this year, in addition to and outside of that pharmacy quality work, in order to identify methodologies for adherence or persistence to oral anti-cancer medications. There are 5 key pieces to this initiative, and again, those are detailed in further within that annual report, and that work is ongoing related to oncology, so stay tuned for additional updates into the future. When it comes to our events, and again, your participation at these events is really what makes them such a glowing success. We hosted 3 key events throughout the past 12 months, and the first of which was our November 2024 PQA Convenes, focused on quality medication use in rare disease. A report was published following that event with key highlights from the different panels and experts that we hosted there. The 2024 PQA Leadership Summit addressed standardized pharmacy measures, highlighting lessons learned, challenges ahead, as well as next steps. And finally, the 2025 PQA annual meeting took us to Tampa, Florida, and allowed for sharing of best and innovative practices, connection with other quality stakeholders, and thought-provoking general sessions. Those general sessions addressed a myriad of areas, including health information quality, obesity treatment and care, Medicare Part D, and value-based arrangements. If we didn't see you at these events in the last 12 months, we certainly hope that we'll see you over the course of the next year. And we hope that you can join us in November for our Leadership Summit and Convenes events, as well as in May at our upcoming annual meeting, which will celebrate 20 years of PQA. To round us out here, our team has been really hard at work behind the scenes on major technology improvements for our stakeholders throughout the past year. Many of these improvements are set to launch in December of this year, including a new website and user portal experience. This will improve the way that you as a PQA stakeholder can identify valuable opportunities to participate with PQA. Watch for messaging in November and December of this year about these exciting updates for our stakeholders and how you can get plugged in. In addition to the website and user portal, we are enhancing our data infrastructure. One example for those using PQA measures is a more efficient, accurate, and sustainable method for creating and maintaining value sets. The 2026 value sets are on track to be published using this new system. This is just a brief highlight, I will say, a high-level highlight of many of the different accomplishments from PQA in the last year that, again, were accomplished alongside you as our stakeholders. For a complete listing of all of these and a deeper dive into each of those mentioned here, take a look at that link that was shared in the chat. So as we reflect on that last year and how we've gotten to this point in time, I'll turn it over to Micah in order to discuss what's ahead for PQA.
Thanks so much, Chris. It's a pleasure to be with you all. Thanks for joining us on the East Coast. Good afternoon. On the West Coast, good morning still. It's one of the strengths of PQA is in our strategic plan and how we approach our work. I learned that when I joined the organization and we went through this process of strategic planning. It provides guidance and direction. It provides a compass and a North Star for where PQA is headed. And it's very much an iterative process, but also a collaborative process. And so we went through this back in 2021 and put together Blueprint PQA 2025. And we're now in the place where we're thinking about the next 5 years. And I'm excited to share a little bit about where PQA is headed and where we see tremendous opportunities in the future. and then also to provide a little bit of context and feedback from what you all told us as we've gone through this process. One of the things that we wanted to start with was kind of PQA's roles in quality and getting better clarity around what we do and how we operate. These are really our core roles. These are the roles that PQA has continued to play for now 19, almost 20 years. PQA has served in a critical role around quality measurement. And quality measurement, as we talk about it, is not just the development of measures, but it's also the stewarding of measures throughout the life cycle and the process. And so we focus these measures in areas such as appropriate use, safety, adherence, and medication management services. And that's really where we operate. But we do that under a very collaborative process, but also a very transparent and consensus-based process. Finding opportunities where there are high priority gaps and aligning them where appropriate with the national quality strategy and the industry much broader than just PQA. We also have a very strong research focus. As you think about research can really be kind of a two-tailed environment where it might surround quality measurement. So research can inform measurement methodologies. It can evaluate impact and then also look at areas such as barriers to medication access and showing the value of medication management services within the industry. So if you think about how PQA approaches research, it's really those areas where maybe measurement is not the right approach, but there's certainly some tremendous opportunities. And we'll talk about a couple of those as we go through the goals and objectives of the strategic plan. We also provide education. This is one of the other core responsibilities of PQA. We bring together the nation's leading organizations that have a role in medication use and the process to work together on solutions. PQA is a very collaborative table, and it's an opportunity for you to sit at tables that you might not otherwise sit at. Our membership is very diverse. And it creates an opportunity for conversations that might not might not happen elsewhere. And so it gives you all an opportunity to interface with folks that can be solutions oriented as well to create those opportunities for industry alliances. We offer tremendous opportunities in the virtual space, but also the in-person space. And we'll talk a little bit about our upcoming opportunities there. And finally, convening is something that we do here at PQA. It's core to what we do, whether we're convening around a hot topic such as AI, or we're convening technical expert panels, groups that may be focused around a very specific scientific approach. PQA brings together industry stakeholders to do tremendous work on behalf of our shared goal of quality medication use. So I think it's important for us to always remember where PQA's unique roles fill gaps, but also how we work together and how we work with broader industries around important initiatives. And these are certainly our core roles that we look at with PQA, the value proposition that we deliver to you all, our members and stakeholders. One of the key aspects of a strategic plan, and one of the things that I found very important as we started going through Blueprint in 2021 was getting the input of our members. Strategic plans are living, breathing documents. They change over time based on market forces, based on dynamics, based on changing environments. But strategic planning as a process really should involve the members. And I believe that, and we focused on that in 2021, and we've done that again this year as we explore PQA 2030 and where we want to be. We wanted to make sure that we get the input from members to help shape the strategic plan on the front end. So much about what a strategic plan looks like can be formed in a vacuum, but without having the input of members and stakeholders, you can run into brick walls, or you could run into potholes that you weren't anticipating. And so you all as members play a critical role in making sure that we can achieve the goals and objectives of Blueprint PQA 2030. So we opened up a survey for about 6 weeks. We asked you all your level of agreement with each of the goals that were proposed. rated the urgency of those proposed goals, provided input on your organization's perspectives, as well as recommendations for strategies and initiatives to enable success. We're not done yet. This survey was certainly a part of our process and how we got to this place today, but we have opportunities in the future. And so your opportunities are not over yet to provide input on the direction for PQA. So we're going to walk through each of the, well, there we go. We're going to walk through each of the goals and then the associated objectives that you all have seen that we provided to you all, and to talk through a little bit of our development and thought process behind each of the goals and objectives, as well as to provide that survey feedback that we received. The first goal is focused around delivering innovative solutions to advance quality medication use for a person-centered and value-based healthcare system. Those terms are very important because if you think about how we want to advance quality of medication use, person-centered and value-based care is where our industry is headed, and we want to make sure that we meet the needs of the industry. The other thing that's really interesting in this area is the focus on outcomes. We know that our members, that you all are focused on outcomes, and you want to focus on the outcomes of care. Those are really important aspects. And so if you talk about measure modernization and where we want to go, it has to be person-centered, value-based, and outcomes focused. And those are the three components of where we want to go with this goal. We know that we have to have innovative approaches. That requires a lot of focus and work collaboratively with you all. With those innovative approaches, we have to embrace digital data sources, and we have to prioritize our patient perspectives. We believe that that will lead to very meaningful and impactful quality measures and a system of quality, continuous quality improvement. This also supports and empowers our healthcare system. It improves it and puts medications, both their use safely, effectively, and appropriately, in a position where we can improve patients' lives. Diving a little bit deeper into this first goal, which you can term measure modernization, this is again one of our core responsibilities in quality, is to focus on quality measurement. Our objectives, the first 1A, because it is so core to what we do, we want to develop meaningful measures that address emerging areas of medication use quality and improve patient outcomes. This should be one of our main goals as healthcare providers, as a healthcare industry, is to make sure that we're addressing those areas of need and focusing on patient outcomes. Second of all, PQA has a unique opportunity to improve the integrity and accuracy of PQA measure implementation across the healthcare ecosystem. The ability for us to have an insight into that process and to play a critical role in ensuring that integrity and accuracy is important to us, and one that we'll focus on over the next couple of years. I think of this very much as a phase 4. PQA measurement doesn't end at endorsement. You have stewardship of measures. And so phase 4 is, if you think about the drug approval process, phase 4 is kind of the surveillance studies and the opportunity for improvement and keeping an eye on things. This is essentially the phase 4. After endorsement, we have to continue with stewardship, and this will be an important component for us in the future. Obviously, with PQA and our measures, we do want to start with the end in mind, thinking about where measures may be used, not just in quality-based programs and accountability programs, but also in value-based arrangements and quality improvement initiatives. So as we continue to expand the use of PQA measures, trying to find unique and innovative areas where we can focus on impact of those measures in a variety of different areas is very core to what we need to accomplish. We've heard from a lot of our members about expanding and leveraging standardized digital data sources in measure development and research initiatives. This is an area where we're very much aligned. We do see an opportunity in the future to help with that process and to leverage those standardized digital data sources to be able to both inform measure development, but also research. And so this is an area that I think is really important, especially as we continue to move through the years and our industry continually focuses on enhancing those digital capabilities and those data sources we're pulling in. We can't advance to digital quality measures without infrastructure. The focus on digital quality measures has continued to be a hot topic, continue to be a talking point, and our industry continues to move toward digital quality measures. But in order to do that, you go back up to 1B and you think about the integrity and accuracy of PQA measures, but also, you know, the standard of digital data sources. Those kind of feed into that opportunity for us to develop and promote that infrastructure that obviously is sometimes behind the scenes, but it's so critical in order to accomplish what we want to around digital quality measures. I mentioned a little bit about our research opportunities. I think as we look at our research opportunities, we want to assess both the existing evidence, but we also want to generate new evidence to advance medication use quality more broadly. I think that's a tall task, but I think it's one that we're up to and our team is prepared for. Finally, last but not least, it's so important for us to keep the patient in mind and the caregivers that are a part of the patient's quality medication use journey. And so we have to really focus on that patient-centered perspective and ingrain that throughout our organization. And in particular, as we look at research initiatives and also our measurement activities, the patient has to be core to that. And that's one of the things that I think sets PQA apart and gives us that unique perspective is we look at it through our educational initiatives, whether you're talking about our annual meeting, our panel sessions, our quality forums and how we run our education sessions, but also our convening activities and our measure development and research. Patients are ingrained throughout that. And so we want to continue to work on that and in fact, kind of enhance the work that we're doing there. Now, onto the survey. What you all told us for goal 1 is you told us that 8.97 out of 10, or almost 90% level of agreement with goal 1 as part of PQA's plan. So very strong alignment in the goals and aims of that specific goal and objectives. The most urgent is very interesting. So the most urgent is going to continue to be developing meaningful measures that address emerging areas of medication use quality and improve patient outcomes. Second of all, developing and promoting the infrastructure needed for digital quality measures was also one of the most urgent objectives. And I think we all kind of are working in this new environment and we see some opportunity there. So very much aligned. And third of all, expanding the use of PQA measures in quality programs, value-based arrangements, and quality improvement initiatives. Again, looking at this more holistically and finding opportunities to reach our shared goals of quality medication use through that expanded opportunity to close gaps in care and identify areas of improvement. Some common themes from the survey and from what you all told us is we need to continue to focus on developing measures that are person-centered and focused on outcomes. Second of all, expanding and leveraging standard digital data sources should be the future of measurement. And again, I can speak from our team's perspective, could not agree more on the most urgent and the common themes that we received. So this is really important feedback and specific focuses that we'll take as we kind of move into the strategic plan. Shifting gears a bit to goal 2. Goal 2 is focused on advancing the quality of medication management services to improve patient outcomes through pharmacist-provided and team-based care. We all know the value of medication management services, and we know its critical role in delivering high-quality person-centered care. Medication management services, when you talk about the holistic nature of medication management services, it's not just medication therapy management services. Medication therapy management services is certainly a component and a critical component of medication management services. But there are a lot of individuals that play a role in medication management services. And this goal really signals that through both pharmacist provided and team-based care, because the reality is when you're delivering effective medication management services, it does take that team to be able to stand up those initiatives to focus on the action plan and where you want to accomplish. And then also making sure that patients at the end of the day, their outcomes are improved. That very much takes a team effort to be able to accomplish. We believe that with medication management services, one of the most critical roles that we can play here is expanding that data infrastructure, demonstrating the quality improvement in the ways that we know how, and also finding a way to recognize those industry trailblazers, the leaders, the folks that are on the front end of this working to advance medication management services. One of the other areas that we have recently signaled is our work around medication access and those barriers. PQA has a role to play there, certainly to collaborate with the folks that are focusing around the importance of ensuring medication access for those patients and the caregivers that take care of them. We believe that also building the capacity of the healthcare quality workforce, it will support a healthcare system where medication use is optimized. We're committed to developing the next generation of quality medication use experts, and PQA is going to continue to do that work in the future. Drilling down a little bit more into the objectives of Goal 2, we believe very much in the expanding of the collection, reporting, and analysis of standardized data to evaluate the quality of medication management services. We've heard from you all about diving a bit deeper into this, and in order to do that, having standardized data is going to be critical. Making sure that we demonstrate the importance and impact of medication management services through our research, our education, and our events and convening activities. And that's something that PQA has continued to prop up, highlighting areas where folks are working together, that you all are partnering together to improve that medication management service, and ultimately improve the patient outcomes that are a result of those. We believe that there's an opportunity to do that throughout PQA and our research activities, our education, and our convening. We need to recognize those pharmacies that are committed to continuous quality improvement and person-centered value-based care. PQA has a role to play here, and we believe that we can identify those pharmacies and work with them to make sure that those pharmacies are recognized for the excellent care and services that they provide. As we've worked through our pharmacy pilots over the past couple of years, we have an opportunity to also promote the use of those consensus-based pharmacy measures to support quality improvement and value-based care. And so in the next couple of years, we want to focus on making sure that we can promote that use of those measures as a way to support the healthcare system. We continue to focus on advancing best practices to address patient needs and overcome barriers in medication access. This is something that you all work in your own environments quite a bit on to make sure that patients continue to have access to medications. PQA has a role to play there, and we're excited to explore that further with our pharmacy access work. Finally, I mentioned a little bit about developing the capacity of the healthcare workforce through our learner programs. I think very much about our professional and student education programs focused on medication use quality. But there's also opportunities through our shadowing programs and other areas where we can work with you all to make sure that we have the capacity built up so we can address the most pressing issues. Shifting gears to look at the survey just a bit. Again, very high level of agreement, 88.5% or 8.85 out of 10. You all said that you agreed with Goal 2. The opportunity to focus on collection, reporting, analysis of standardized data to evaluate the quality of medication management services was one of the most urgent objectives. Demonstrating the importance and impact of medication management services through research and education and events was also high on your list of urgent opportunities. And then finally, advancing best practices to address patient needs and overcome barriers in medication access. So those were the most urgent objectives as indicated by you all through the survey. The common themes that we saw throughout the survey was PQA should emphasize pharmacists, pharmacy services, and patient support and education in demonstrating the importance of medication management services. So if you think back to our roles in quality, I think we have an opportunity to really leverage our unique position within the industry to accomplish that goal. And then also prioritizing the expansion and standardization of data in medication management and pharmacy services. That is certainly something that is top of mind for us as we go through our exploration of what we want to accomplish in the next couple of years. I think this is going to be a heavy lift, but one that we will work collaboratively with you all to make sure that we can accomplish. And goal number 3, we're focusing on achieving organizational excellence through structured processes and technology that deliver exceptional value to members, stakeholders, and staff. So much of the focus, and you all as an industry also focus on infrastructure. Us as a small nonprofit, we are focused on the exact same thing. We believe that we should offer best in class through our roles and responsibilities. We should offer best in class. And you've heard a little bit from Chris earlier that we're working actively to build out user interface and also to undergird everything we do by enhancing our technology and our infrastructure. These are important investments that our board has made in the organization, and so we want to continue to strengthen that foundation to advance our mission in the future. We're looking and focused on building a future-ready technology infrastructure and streamlined operations. That's so important for you all as we go in this next phase of healthcare transformation. But we believe that it's really for a benevolent goal, and that's to empower you all as members or stakeholders, but also to empower our staff internally to be able to collaborate effectively and innovate with confidence. That's something that we talk about a lot internally, but it's also something that you all work on in your own industries. And so the opportunity to have that shared goal is really important. Not lost on us is the importance of fostering that person-centered and inclusive environment that PQA continues to attract skilled and talented experts and reflects the diversity of the communities it serves. PQA's focus on inclusion is certainly very important. It's what makes us so strong is our opportunities to work together in industries that may not work together otherwise and to find the solutions. And so we want to continue to leverage that to deepen that work as we continue to focus on 2030 in our future. This work is also essential to our sustainability as an organization. We want to be able to deliver consistent value and also reinforce our commitment to excellence as an organization. Diving a bit deeper into the objectives, the first is always about engagement and participation. And we want to always engage with our members and maximize that engagement, participation, and satisfaction. We want to make sure that we deliver the services that we say that we will to you all with a commitment and conviction. And then you leave our meetings and our opportunities to engage, feeling a sense of being a part of the solution, being a part of the future, and finding areas of alignment. We are focused internally around our technology infrastructure. We want to drive resilience, future readiness, stakeholder engagement, and operational efficiency. Those are the four core aims of what we're trying to accomplish with our technology infrastructure. Ultimately, at the end of the day, you'll see it on your end, but internally right now, we're all focused on making sure that we get those things right as we go. And so a lot of unique opportunities that you will see in the next couple of months that will come out are the process of months worth of work internally with our team. You can't have any conversation without at least signaling investigation of the use of artificial intelligence to optimize that organizational performance and accelerate innovation and medication use quality. This is an area that we as a staff have focused. This is an area where our industry is focused on what that might look like in the future. So working together to try to figure out where it fits, how it plays a role, how artificial intelligence can empower and support better patient outcomes and innovations in areas that we may not have thought about before. That's certainly something that we want to continue to keep an eye on. I've mentioned a little bit about a person-centered healthcare system. I think we as an organization focus a lot on a person-centered culture internally. We also want to continue developing and ensuring a dynamic people strategy. Our core tenets that we want to focus on as an internal staff is trust, empowerment, and satisfaction. And so as an internal organization, we focus on those areas, but that also trust, that empowerment, and that satisfaction extends to our members. It extends to our stakeholders and how we interact with you all. And so internally, we focus on this, but externally, we want to continue and have that same shared focus on trust, empowerment, and satisfaction. PQA as an organization has always been inclusive at our table. We want to continue to cultivate that. We want to value and leverage the unique perspectives and contributions of all our stakeholders. That is our secret sauce. That is what sets PQA apart. And we want to continue to cultivate that and not lose sight of that inclusive environment that we offer. Finally, you can't have good structure without standard policies and procedures. And so the implementation of standard policies and procedures, both internally and how we operate, but also externally, how we interact with our members and stakeholders is so important. It provides consistency, scalability, and efficiency within our organization. And so these are the objectives that we want to focus on between now and 2030. Again, alignment with this goal is around 85% or 8.53 out of 10. And so we have level of agreement very high, again, with you all, as you told us. The most urgent objectives here is top of mind is cultivating that inclusive environment that values and leverages the unique perspectives and contributions of all stakeholders. Secondly, maximizing engagement, participation, and satisfaction related to PQA activities. I very much see those first two as hand in hand. And so I think if you accomplish one, the other will flow, and vice versa. And third, artificial intelligence is clearly on you all's mind as it is ours. And so you all told us that the most urgent is to investigate the use of artificial intelligence to optimize organizational performance and accelerate innovation in medication use quality. A couple of common themes here that we pulled out of the survey. The first being PQA should provide high-value services to members and stakeholders and be proactive in their response to government priorities and initiatives. I think you all are aware of the environment that we're in, and there's a lot changing very quickly, and it's very much a dynamic environment. And so we're very in tune to that. We talk about that as a team and certainly as a board as well. And so that's a common theme that I think you all share that we do too. And so the second is modernizing PQA's technology infrastructure. I think that's so important as we enhance stakeholder communication, enable work, and improve data capability. So could not agree more. You all focus on your own technical infrastructure, technology infrastructure. PQA is equally focused in that area. A couple of other themes I wanted to bring up and trends that you all told us that are emerging in the marketplace that we share that perspective and that eye on. The first is the fact that technology, including artificial intelligence and digital health, continues to transform healthcare and how we measure the quality of care. Secondly, focused on the continued growth of value-based care within the larger healthcare system, and the belief that you all have shared that it will continue to grow alongside that drive to make care more person-centered. And so that's also another emerging trend that we see. Third, again, I don't have to tell you the dynamic federal policy landscape. We all work through it, and it's very important, and you all wanted to make sure we had an eye on the dynamic federal policy landscape and how it could impact medication use quality measurement. We share that eye toward kind of the federal policy landscape and the opportunities for the future. And finally, it goes without saying, as we focus on our populations, the population is aging and chronic comorbidities. That creates new challenges, but it also creates tremendous opportunities for PQA as an organization, and also our members and stakeholders as we continue to address the healthcare gaps that are out there, but also those opportunities to improve health outcomes. So those are a couple of emerging and future trends that we wanted to signal. These are areas that we talk about internally as a team, but these are also areas that you all are focused on. And so I think these are great themes to pull out. Also some opportunities if you think about our convening and education capabilities, areas where we can focus on providing that meaningful content to you all to be able to inform your own practices as you go. As I mentioned at the very beginning, this is not your last opportunity for input. We're not a one and done as far as the survey goes. The survey is just the start. One of the things that we did in 2021, partly because we were coming out of COVID and there was an opportunity to get people back together in person, but also because we wanted to make sure that we had a critical eye on the future as it is seen through your eyes. So in 2021, we convened all of our members to talk about the goals and objectives, strategies, and tactics we need to accomplish, and built a robust and sustainable and durable strategic plan that we followed over the last 4 years. We're going to do that again at our Leadership Summit on November 13th and 14th here in Arlington, Virginia. We want to focus on a couple of key questions. We want to make sure that we have an eye on what we should do to implement the goals and their objectives. We also want to focus on partners and the resources that we need to implement the goals and objectives. So much of what we do as a staff is driven by our engagement with you all. Your participation, your volunteerism at our table makes all the difference in whether we're successful or not. And so we want to make sure that we have an eye toward effective partners and the resources that we need. Finally, how do you track progress? What are the milestones and incremental steps that can be used to evaluate our progress, especially in some of these areas that are current and emerging? How do we track, the implementation, adoption, and the use of AI within our industry? Some of those are a little bit more challenging than others, and so we want to make sure that we have your input on those areas. So these are just a couple of questions that we'll address at the Leadership Summit. Really excited to see you all in mid-November in Arlington, Virginia. The opportunity to interface. I'm a huge in-person person, and so I like talking face to face with you all, hearing your perspectives, being able to share your greatest wins for the year and your greatest opportunities for the future, but also being able to talk about the wonderful role that PQA plays in supporting you all to achieve what you want to and what you need to improve patients' lives. And so I hope that I'll see all of you at the Leadership Summit. I hope that we'll have an opportunity to sit down and chat more. We're going to be working through breakout groups, and so it'll be small group discussions where we'll capture all the feedback and then put it into a more comprehensive document to be able to inform the next iteration of the strategic plan. So with that, I am done with my official capacity, but we do have a question and answer session. So I'm going to invite Chris and
Thank
Tammy
you, Micah.
come on board.
Thank you, Micah and Chris, for this thorough description of the PQA 2030 blueprint and the goals for our organization. I am personally very excited to be a part of it. Please remember to submit your questions using the Q&A feature located at the bottom of your screen. We will answer as many questions as we have time for. All right, gentlemen, I have a couple here. Could you describe the role of the board of directors in the process of creating the Blueprint 2030?
Yeah, happy to jump in on there. So our board of directors is one of the strengths of our organization, the vision, the 50,000-foot view, setting strategy for the organization. Our board is very much a strategic focus board. We have worked through some of these goals and objectives at the board table, and so our board has had an opportunity to weigh in on that. Our board has had an opportunity to share their perspectives. One of the things that we always focus on as we are a competency-based board of directors, as PQA focuses on the future, PQA wants to make sure that we have a board of directors that's truly representative of our industry. And so much like the table at PQA is incredibly diverse and inclusive, our board takes that same approach. And so our board has operated throughout this process, providing guidance, direction, input, adjustment, changes. And so the initial conversations and the initial goals and objectives, some of them have changed a bit based on the representation that we have around the board and the input from that board to be able to focus in areas that maybe we missed or maybe that we needed to deepen our work. And so our board has been with us throughout the process, much like our members and also our staff. So the board plays an incredible role. The board will be meeting to endorse the strategic plan at the end of the year. So it'll be board endorsed. And that will give us our ability to kind of set the course and set the map for the next couple of years. And so excited to walk through this process with our board, have them work through adopting the strategic plan. And then the most important and the fun thing is to be able to implement the strategic plan over the next 5 years. And so we'll wrap that up by the end of the year and start off 2026 strong.
Yeah. Our next question, these goals are very broad. How do you choose specific projects or initiatives to make progress and achieve the goals within 5 years?
Yeah, that's a good question. So I mentioned that we take an inclusive approach, having our board guide and shape the strategic plan, and having you all, the members and stakeholders, weigh in, provide your input, help us to refine those goals and objectives as we go throughout the process, and then also to provide all of the input around who we need to work with and how we need to set those standards and the ability to achieve those goals and objectives. And so the membership and the stakeholders, as well as the board, play a critical role. One of the groups that I do like to include when we do a strategic plan is the actual staff. And I think whenever you're talking about a strategic plan, that full alignment between board members and stakeholders and staff around where we want to accomplish and where we can be most impactful is so critical for the success of a strategic plan. Being able to adjust for things that we hear from you all as members and stakeholders, being able to adjust to industry trends and changes, but also kind of changes in strategic direction. Those types of things are all pulled from those bits of information. And so whenever you think about a 2030 strategic plan, one of the things that I struggle a little bit with is making sure that you understand and you're intentional about deciding what's the highest and the most urgent, but also what is the highest impact. And so sometimes the most impactful is not always the most urgent. Sometimes you can accomplish those things on your checklist that maybe only take 3-6 months to do, versus a long scale 3-4 year project. And so you have to have that eye toward a 5-year strategic plan, adjusting where you can. But whenever we talk about choosing projects and initiatives, it is so much based on the input that we receive, the conversations that we have, the people that are at our table that talk about the urgency of things. And so we have agreement on things, but the urgency of certain things may rise to the top. Therefore, we may want to shift that opportunity to try to accomplish earlier on. And so it's very much a yearly process in building out strategies and tactics. And so we apply a GOES principle to strategic planning, which is the goals, objectives, strategies, and tactics. And those strategies and tactics are very much more targeted, focused, and specific and detailed. And so we evaluate our team and the organization based on our ability to achieve those strategies and tactics. Some get accomplished, some get rolled to the next year, and then some become deprioritized based on changes in kind of the larger market. And so we very much focus on that as an organization, as a team, as a board, and also to make sure through our annual report and other areas where we can talk about our accomplishments and what we were able to achieve.
I appreciate that you are always supporting all of our achievements. Can attest. You do a great job. All right, our next question. How do you see members participating in PQA's work against this plan?
You know, one of the things, first of all, being at the table, being a part of our panels, always putting your name forward or putting a colleague forward to participate in our work is probably the most important thing that our members can do. Recognizing that our team is 35 members strong, we are a small but mighty staff, but we can't do it all. But we also don't have the expertise that you all do. And so the first thing that I could say is show up, be engaged, be participatory, step up and submit your panel conversations, and make sure that you're represented around the educational table. We're always looking for innovative things to do. We're always looking for innovative programs to stand up. And we're always looking to prop up and promote those best practices that you all are achieving. Even the promising practices, the areas where you're not really sure that it's gonna work, but it's a really cool project anyway. So I would say, show up, be engaged. One of the areas that I mentioned, and it's mentioned throughout a couple of goals, is standard approaches to measure modernization, standard approaches to data collection, data use. I think that's an area where we see tremendous opportunity, but we can't do it all ourselves. And so I think from our perspective, we'll be looking to partner with organizations that want to work with us to help use those standardized data sources, but also to create the opportunity and the momentum for driving healthcare quality and specifically medication use quality through standardized data approaches, because that will inform measurement, that will inform research, that will support providers to be able to deliver the care that they need. It'll support our members that are health plans and able to show the value of the services that are a part of their offerings. And ultimately, it'll demonstrate to the healthcare system the role and the value of quality medication use in improving patient outcomes.
Thank you. I don't have any additional questions at this time. So we'll go ahead and move into our announcements. Great. So first announcement is that the registration is open for our PQA Convenes in 2025 PQA Leadership Summit, like Micah was talking about earlier. Both of these events will be hosted in Arlington, Virginia. PQA Convenes will take place on November 13th, which is a Thursday, and will bring leaders in artificial intelligence together to discuss the impact of AI on quality medication use. Additionally, the Leadership Summit will follow right on the heels of PQA Convenes and take place on the afternoon of November 13th and into November 14th, with the focus on this blueprint that was discussed here today by Micah and Chris. We have sent registration information to the key contact for each PQA member organization. And if you have any questions about PQA Convenes or the PQA Leadership Summit, please email meetings@pqaalliance.org. And we'll put that contact info here. Additionally, please join us for our next stakeholder advisory meeting, which will be just in a couple of weeks on October 22nd at 1 p.m. Eastern. Registration information is available to PQA members in the Member Resources Library, or you can watch your email for updates, and we look forward to seeing you there. Next, our annual meeting. The call for breakout sessions and poster abstract proposals for the 2026 PQA annual meeting is open. The meeting will take place May 12th, 13th, and 14th in Baltimore. And the due date for our educational sessions is Friday, November 7th, so about 1 month from now. Additionally, the poster abstract deadline is Friday, January 16th. You can submit a proposal or find out more information using the link that we'll put in the chat. And last one, our next quality forum is one of our favorites. It will be hosted on Thursday, November 20th at 1 p.m. This is a members only webinar, and our topic will be the Medicare 2026 Star Ratings Update. That webinar is sponsored by PQS by Innovaser, and registration information is available to PQA members in the Member Resources Library, or watch your email for updates. There we go. Thank you very much to all of you for joining us today. Have a great day, and we'll see you soon.